Welcome back to ComplyPlus Presents. Today we're talking about digital literacy in health and social care. I've got my colleague here, Lewis. And for those that watched the episode last week where we were talking about the illusion of plug and play competence in health and social care, we swapped places. Normally, I'm sitting where Lewis is sitting, and we swapped around. So I'm going to be asking a lot of the questions. And Lewis is in the hot seat. How are you today?
Yeah, we're all good, thank you. Yeah, looking forward to getting stuck into this sort of mini series on the back of the last episode. I think it offers a bit of a different perspective from what we've been doing so far, and based on the feedback we've had, these are some of the other insights that people are interested in. So yeah,
Definitely. And obviously, Lewis spends a lot of time talking to health and social care managers, leaders, and even some professionals here and there as well. So he does understand the pain points, what are the things that are keeping them up at night. And when there's a deluge of software systems, from recruitment, HR, rotoring, and policies and procedures, e-learning. I mean, the average company is using 8 to 10 software systems. And one of the understudied problems, perhaps the lack of it, is digital literacy.
Yeah.
So quite often we are rushing to talk about compliance systems. We're rushing to talk about digitization of processes, training platforms, all these digital tools as solutions. But actually, what I learned in practice, all the years that I worked in the NHS and in the private sector, is that adoption actually depends on people as well.
Yeah.
Whether they have the knowledge, the skills, and confidence to use the systems. Otherwise, you could have the best systems in the world, but actually, if you don't address digital literacy, then that is the biggest hidden barrier. And I don't even know whether it's hidden. It's well known that the care sector is not great.
It's well known, but I think it's like you say, it's the level. It isn't just about how to use a computer necessarily, or understanding the difference between a phone, a tablet, a computer. There's a lot more to digital literacy, which we'll go through later. So yeah, it doesn't quite sound as flashy as AI, which is obviously very prominent in the news and even with the Prime Minister and everything at the moment. Or it might not be directly to do with compliance and ticking the box of compliance and doing things properly and so on. But I think more often than not, it can be the deciding factor on whether something is successful or unsuccessful, whether it's bringing in a new piece of tech, whether it's changing the way you do things operationally or as an SOP. This can be a bigger factor than I think
Many people realize.
People realize, yeah.
Even a dashboard, actually, just minor tweaks to a dashboard. We've seen that with a few of our clients where the compliance officers are so worried. Then you add an additional step on the dashboard that just clarifies it for everyone. So, look, perhaps we need to define what digital literacy is. What do we mean by digital literacy? And I think the more simplified it is, the better.
Yeah. So like I say, for me, it's not just about how to use a computer. It's looking at things like the knowledge, skills, and attitudes needed to confidently and critically use digital technologies. Whether that's, like I say, within a workplace, or whether it's in our everyday lives. Obviously, a lot of people are being forced to use tech more now. You go to restaurants, they don't take cash. It's only contactless. Now, many people will think, how is that necessarily digital literacy? But it's a digital format of payment, for example. So even little examples like that in our day-to-day life, some people still, I've got people in my family, older generations, that still wouldn't know what to do in that situation, for example. And you see it in various examples now, even in workplaces. It could even be how you sign into work. There might be an iPad now where you're taking a fingerprint or you're signing a digitally signing something. Even contracts, even in our business, we've completely revolutionized how we get people to sign contracts. Whether it's
we don't actually have any paper at all in our business.
No, it's paperless.
A few people bring their notebooks, but I've got a digital notebook, and I like pen and paper, but I've had to change, just like we've changed with banking, just like we've changed with many applications that we're using. That's really important, isn't it? Yeah.
But like you say, it's how people then learn to adopt those things. That's where that's where it can come in. So, like I say, digital literacy isn't oh, you're brilliant on that iPhone or that smartphone. You know your way around the apps and stuff on there. There's a lot more to it, and also it's the competency side as well. Because, like you say, you can have the best system, you can invest in the best systems, but it's not going to guarantee results if you've got issues with digital literacy.
Yeah. So, I mean, in day-to-day life, we've been using search engines for a long time now. And people use platforms like Facebook, like TikTok, they order food on Deliveroo or get a taxi on Uber. So we live in a very highly digitized society, in things that we never imagined to get in our lifetimes. But in health and social care, it's about information management as well, isn't it?
Yeah, information management is information management is key. Data is everything. We've seen incidents where there's been cyber attacks, for example, on data centers that are holding patient data and so on, and we see the chaos that it causes because of the sensitivity around that data. It's not it's not just basic data like a name and an email. It can sometimes be people's health records or.
So in this case as well, if you look at broadly compliance side of things, you have policies and procedures that are now uploaded to different systems.
Yeah.
You also have reflective logs, for example, if you're looking at the evidence for regulatory compliance. So what do you think about people's attitudes around managing these files responsibly? When you think about it, what needs to be considered? Because emails, portals, learning platforms, technical skills, or is it?
I think there's a few different. If I break it down into sort of components, when I was preparing for some of these sort of discussions yesterday. So you're looking at things like finding and evaluating information, for example. So can people use a search engine effectively, but also can they identify what a credible source is or what isn't credible? Because just because it sits on the top on Google, or as we know, the infamous Wikipedia, it doesn't necessarily mean it's 100% correct or even the best source to use. Or now you've obviously got ChatGPT, which is taking over search engines. Obviously, Google have got Gemini, for example. Everyone used to run to Google, but if you see at the top now, you have the Gemini, which is the AI search, which almost condenses your options and summarizes things. You've also got then creating and managing information. So things like whether you're uploading data, is there reflective logs? Do they know how to manage digital files? Do they know how to label them? Do they know how to secure them?
Even version control. We've seen that when
Version
you're doing
control.
audits, isn't it?
Yeah.
And you see that they have a version there that is out of date.
Yeah.
And it doesn't matter, actually, if people are using the version that is out of date, all the work that you have done goes to nothing.
Is a waste, and you almost have to go back to square one. So you've wasted businesses' time, resources, and your own time.
But also potentially putting the organization at risk.
There's high
people
risk.
at risk,
There's high risk.
What you're saying there combines a lot of things. Because even yesterday, I was at UCL yesterday, and you have discussions with postgraduate students. We're talking about governance, the importance of governance and regulations. So safety online, data protection, dealing and avoiding misinformation. Because there's a lot of information out there, but actually, if we don't know what you're looking for and how to look for it, that's a big problem, isn't it?
Yeah.
Data privacy as well, breaches that we've seen over and over again. What is it around cultural and social understanding of these systems as well, from your perspective?
Yeah, I mean, for me, that's very, that's very, very important. Having, like you say, having that awareness of even things around sort of permissions, making sure the right people have the right access, being able to communicate properly as well. What things are safe to send in an email. What files are safe to send in an email, for example. What things can we use things like WhatsApp for now, which is more phone-based. You've obviously got other channels like Slack and other businesses use for internal communication. You've got Microsoft Teams, which is obviously a popular one now. And then, like I say, you also then start looking at things like the technical skills. And then, like you say, around sort of online safety and awareness and some of the culture issues as well, understanding like I say, how to act safely online, what websites to go on, what sort of systems do you have from, say, a cyber essentials perspective as well. Many businesses ignore some of those things that are really, really important.
So when we hear that Marks and Spencer, Jaguar Land Rover, even the NHS sometimes have been attacked and their information is held and they've been pushed to pay a ransom. I don't know. What is it that makes people think that they are immune to that? If these big companies are facing cyber attacks, I don't know whether, in your discussions with people, do they ever worry about cyber security and how secure their information is if it's sitting on our systems, for example?
Yeah, I mean, I think there's always with sort of even when GDPR came about, but even the IT hardware and software side of things, firewalls and all the things that protect our devices, antivirus, all those things. I think there is a bit of resistance to it because people maybe don't understand it or don't feel they have the time for it. They might not have, depending on the size of business they are, they might not have, a department that looks at IT or IT infrastructure, or they might not have a data protection officer, for example. So there's definitely a lot of problems around that. If some of the bigger companies that do take these things seriously are getting attacked, you can only imagine the risk that some of the smaller providers have if such an attack was to incur. But it's not always necessarily about cyber attacks, and we hear about these big ones in the news, which are being done from people in their bedroom, all parts of the world. It's almost like a movie in a way. It doesn't sound real.
Yeah.
But the other risks, like you say, are internal. There's a lot of internal risk as well that can be put on an organisation or a patient or a service user or even a member of staff if things are breached or data is mishandled. So I think that's the other aspect that I see people not really talk that much about. We all like to think we can trust our colleagues.
Yeah.
We would like to think we can trust our boss or the person we work with every day. But if systems are there to be breached and there's ways in which people can use information to, whether it's to manipulate, to bully, to harass, to extort, there's those other risks as well that I think a lot of people like to look at external risk.
Yeah, but not internal.
But internal risk is just as high, really. Yeah.
So perhaps one of the things we need to look at actually in some of our webinars and discussions with service users, with service providers, decision makers, is to perhaps tease out some of the challenges they are facing, but also assess their awareness and readiness for digital tools.
Yeah, definitely. Yeah.
What sort of risks are you bringing to your organization by bringing these tools in, that awareness? So I've summarized actually to say, look, digital literacy is not just about clicks and dashboards. It's about building skills and confidence.
Yes.
Critical thinking and safe practice, building on safe practice. And just building up on the back of that, we have, I don't know how many times we've sat here and talked about how much there's tick boxing in health and social care, from the NHS, to private providers, to small care homes and domiciliary care providers. There's a lot of tick boxing. And we're always saying to people, compliance isn't just ticking boxes. We're always saying to people, it's about governance, it's about safeguarding, and ultimately service user safety. And nobody talks about digital safety, digital literacy and safety. How do you sort of view that?
Yeah, I mean, I think, digital literacy, it is very, very important because, like you say, if you're bringing in these systems or maybe some of these changes are forced as well, you've been told. That
so you're not ready. There's no organizational readiness.
There's no organizational readiness. So if you're not ready, you bring something in, then your staff aren't ready. They might not have access to adequate training. They might not have an understanding even why you've brought this thing in. Because, there's always that adage with workforces, well, we've always done it this way.
This way, yeah.
But unfortunately, life moves on, things evolve. These technologies are brought in to make life easier for people. But if
supposedly.
it's not, yes, exactly. If it's not sold that way and people don't feel ready and they almost feel ambushed by it, then that's a problem. So I actually think whether it's even part of the recruitment process now for providers, whether it's part of their onboarding, their day-to-day mentoring, even if they need to do annual skills assessments outside of your mandatory and statutory training, let's say, I think it's a good investment. Yeah,
but it doesn't tick a box.
But it's not ticking a box, and you're not going to probably get much kudos from anyone for it. You're not going to get a gold star or a better CQC rating. But what you're probably going to get is efficiencies, which, in theory, should lead to better results in other areas.
I remember we had a meeting in Birmingham many years ago, and we were talking to someone who was quite highly placed, working for he was actually managing contracts for these big professional bodies in the UK. And he was saying to me, he's shocked at the poor digital literacy in healthcare, because he was talking mostly about the NHS. And he was saying, I would say to you, if you're a ward manager or a department manager, any employee that you hire, even if it means you spend just 30 minutes with them one-on-one to talk them through data security, cybersecurity, all these issues, and also to assess their digital literacy, that would go a long way. And for me at the time, it wasn't making much sense. He was doing a PhD in cybersecurity. It was coming from public policy. And I never quite understood that until much later, when you get in a position of authority and you start dealing with problems. Then that's an issue. So when I look at social care versus NHS, and I think we've done this many times, so to say, look, if you compare healthcare and social care, what is the readiness gap? Because you deal with all sorts of organizations, dental practices, GP practices, NHS trusts, small care companies, startups. What do you see when you talk to them when it comes to digital readiness?
I mean, yeah, look, based on my experience in client facing, and even when we've gone in to do maybe some consulting in these businesses, so we've actually been in the workplace, we get a feel for it, rather than just, Zoom calls or telephone calls or exchanging emails. There's a clear gap. There's a clear gap. Healthcare providers are more advanced in this area in particular. It doesn't mean that they're running better businesses or better services or better patient care, better patient safety, whatever. But in terms of the digital literacy, in my experience, they've got a lot more readiness. And there's obviously clear reasons for that. They'll have admin teams, they'll have budgets for IT, they'll have contractors and suppliers that can support these services.
Do they have better awareness, do you think?
I don't know if better awareness is the word. I don't know if better awareness is the word. I think they probably take it maybe a little bit more seriously. And maybe due to the nature of those services as well, they do rely on technical, digital a little bit more. I think, if you go.
So then you need to build the in-house capacity.
So you need to build the
support
in-house
that.
capacity, otherwise the business wouldn't function. If you go into a GP, a clinic, a dental service, even a hospital, there's tech as soon as you go through the front door. But sometimes in the adult social care space, there's a little bit, you can tell it's less advanced or less modern in many cases. Not all cases, but in a lot of cases.
And I know you have said that many times. Even last week you were saying those in social care, I wrote it down actually to say they're wearing multiple hats. They're the HR lead, they're leading the recruitment, the rotas and all. So do you want to expand a little bit on that? Because I did feel that it was relevant, although we've talked about it in another sort of setting. I think it's quite relevant to this right now as well, isn't it?
Yeah, it is. Like you say, I think particularly in adult social care and smaller businesses, people are doing multiple things. And when you're in a job role where you are looking at all those things, or you're a business over a small business, you have to spread yourself quite thin. So you might just want to do the very basic, or you might not have time to understand the awareness and the impact it's having on your business. Like I say, we have people that sign up for compliance systems. They'll pay the fee, whether it's a monthly plan or an annual plan, and then they'll barely use it. I think I said it in the last episode. We had a client recently that signed up, used it for the first 6 months, raised quite a few support tickets because of staff issues, not knowing how to use it, this, that, and the other. You try and help them. You offer them onboarding. They don't make the time for it. They don't listen to the advice they've been given from the product specialists on our side, and then they haven't used it for 6 months. Then they start getting the renewal reminders. Your subscription is due to renew. Panic stations, calls, emails. I need to speak to someone. Could you remind us how to use this system again? Can you tell us exactly what it does again? Because we can't quite remember.
But we're paying for it.
But we've paid for it, or we are paying for it. So I think, there's a lot of cases, I must admit, as particularly with the smaller dom care providers, the people working in the adult social care space, there is this almost... You can tell when you're speaking to them, there's that hurried approach. They need something quick. So something's happened or something's coming up. You don't need to ask because you know. You can sense by tone, the language used in the emails, the urgency, the fact that they're pressuring our teams rather than us having to follow them up to find out if it's something of interest. But then the problem comes from that implementation side, the readiness, as you've said, is the better word.
Yeah. Look, we're not saying people have to be digital experts, are we?
No, and I think there's also a duty on training providers and compliance providers like ourselves to offer some of this help as well and build it into the product that we're offering as well as part of the service offering. So I'm not saying the whole burden of this should be on businesses, but I think as employers there's a duty to there's a duty to the staff, the employees, and we can't make assumptions. Granted, in a generation or two's time, you would think with the exposure young people have now to technology that they are going to be more advanced when they go into these roles than maybe care forces that are currently in place or even previous generations. I think that's a fair assumption to make.
But then that also depends on the culture.
Yes.
Because all these people we're talking about, if you do a sample of the average care worker or healthcare worker, what is their age? A lot of them are on TikTok, on Facebook, on Instagram. They're ordering on Amazon. They're ordering food and hiking taxis. So why is there such a missed opportunity to bring those things that we do in our lives day to day into practice, right? For me, yes, definitely we are getting a workforce now that is more exposed to digital platforms.
Yes.
But maybe people separate to say, yeah, I do that in my life. I'm quite okay doing this.
I see what
in
you
my
mean
life.
in terms of application.
Exactly.
Yeah.
Exactly. When I get into work mode, tell me what you want me to do.
Yes, rather than maybe try and learn or upskill yourself or get yourself prepared for that eventuality. Yeah, I think that there's definitely an aspect of that, and then that goes back to some of the other discussions we've had on leadership, culture.
Yeah.
But I think it's also a case of making time, do a needs analysis to sort of see where your team's at, digital literacy wise. It doesn't mean you give people tests or you make them go home and read manuals about how to use all these different systems in the business, but there's some quite easy sort of diagnostic tests that you could run to establish digital literacy and see where your business is as a snapshot.
Yeah.
And then from there you build a plan. We were discussing it on the last episode where we were talking about plug and play systems. Are people involved in decision making on what systems to use rather than just the decision makers or the budget holders? A lot of times people just said, look, here's your login details or here's your access to this system. Good luck. They don't even say, look, if you've got any problems, where do you go? There's some videos here. It might be worth looking at these tutorial videos first before jumping in. But again, that goes back to mindset, isn't it? With some of the things we offer some things that are quite boring to people.
Yeah.
And like you say, the human being's mind, as you rightly said there about separating my social personal life and my work life, they're quite happy to learn how to use Just Eat app or Deliveroo app or the Uber app because that's satisfying something in their personal life. But like you say, you give them a Care Docs app or, this is your new compliance system where your training is going to sit. Are people going to want to learn? Like you say, they were going to want it maybe more on a silver platter.
Yeah.
So I think that's a fair comment as well. And I think we'd probably be talking about a lot of the workforce, even in the UK, to be fair, with that.
It's broader than the care sector.
Yeah, it's broader than the care sector. I don't think it'd be fair just to tarnish the care sector with that. I know several examples of, where, people just don't want to adopt the technology or maybe they haven't had the support from employers to adopt it and people feel a bit ambushed as well.
Yeah.
And that can also cause resentment towards the organisation. So when you go back to culture, maybe sometimes if you're changing how people are working, whether it's their processes or their policies on how they work, that can cause other HR-related issues to do with
it's
performance.
actually considering all those things to say it's not just a matter of selecting the right technology and ensuring it's the right fit, but also looking at people's readiness, involving them as well. Because even in our organization, I've said that a few times to say I'm one of the older employees. And I'm amazed actually at what we do with tech in our business. And a lot of those ideas are coming from much younger team members.
Yeah.
You know, they're very bold, and they'll tell you actually when things are not working right. If you give them a chance, they'll give you feedback. So I've learned actually to ask a lot of questions and to ask for solutions. Then people go away and constantly amaze you. So I want to put it out there, I was scribbling things as Lewis was talking there to say, look, it's not just about money, where we're spending money.
No.
Then there's a missed opportunity. We're also saying poor adoption can undermine governance.
Yeah.
Poor adoption
100%.
can undermine compliance. And even when I talk to CQC inspectors, and they don't just want to see that you purchase some training and you've got some certificates.
No.
They actually want staff to be able to prove that they know what they are doing. They want staff to be able to show them that they are competent.
Yeah.
The records also need to be accurate, they need to be secure, evidence needs to be readily available. And when we don't have digital confidence, it becomes very clear that your systems are not delivering on what you're expecting them to do. So I don't know, how do people feel about that if you put that across to them?
I think it's a hard conversation to have in our sort of position. Our platform to discuss those things are on channels like this, because obviously the other problem we have as a provider is it almost like we're trying to upsell other things to them, and we're trying to extend our service and our value to them. But a lot of these things we. Like I say, we take these things quite passionately, and it's not about even from our side how much more money can we get out of this client. It's
quite
about
often it's part of the service, isn't it?
Yeah,
to give you a demo.
Yeah, onboarding and things like onboarding and stuff. We don't really factor that much into our costing. Obviously there's elements of it factored in, but a lot of it we feel, look, if this client is going to trust us with this part of their business, which is a pretty serious part of their business, we want to show back that we're ready for them.
Yeah.
But what we believe and the issues we're seeing still on a day-to-day basis is their readiness. And digital literacy, although it might sound like a small part of it, as we said at the start, it can be the deciding factor. Sometimes with clients, you might actually know from, say, how the onboarding session went, whether this is going to work, whether it's not, whether it's a temporary solution, whether there's other factors at play, they're putting a fire out or something like that. It can be quite obvious usually,
Yeah. So I've heard people say they've wasted money on tech. Oh, we got this tech in, it just didn't work. And then when you probe them further, you realize actually that the skills gaps and even their attitudes to the digital platforms as well was actually the hindrance to proper adoption. That takes us to the next stage, which our team wanted us to talk about, the responsibilities of employers, employees, and then that wider governance. Because sometimes actually, even when you look at CKC, I always say when I go sometimes to deliver training, because I still do go out there and deliver training so that we stay connected. I say to people, whose responsibility, I give them a case study and say, whose responsibility is it? It probably falls under the well-led domain.
Yes.
The CKC well-led domain. And in most cases, people push it back to management. It's the responsibility of the managers. I just think, well, but don't you have a responsibility as well as far as leading yourself?
Yes.
As far as actually knowing what to do and raising concerns where things don't feel right or don't look right.
Yeah. I agree. Like I said, I think we touched on it slightly. There's definitely a duty of care from providers and employers, but I also agree that there should be an expectation on employees to learn how to adopt some of these things, to take time to understand them. I think too often sometimes there's this expectation that it should be rolled out on a red carpet. In any job, people need to be competent in what they're doing. Otherwise, they run the risk of losing that job. And that's always how the world has worked and will continue to work probably for a while. So I definitely agree. I think employees, they have to make sure they know, what they're doing.
The duty of care extends as well to practitioners. If you're a nurse, you're a doctor.
Yeah, exactly.
It's in the code, actually. It's
Yeah,
part
yeah,
of
yeah.
the code, professional code. And then for healthcare workers, support workers, ancillary workers, they also, the moment you sign a contract to say you're going to do this job, that's your duty of care as well.
Yeah.
So sometimes actually there's this assumption that it will just go to the employer or the managers. No,
the issue will go to the
after Mid-Staffordshire scandal and the Care Act, it is very clear actually that responsibility is on everyone.
Yeah.
And also your part of your personal development as well as a healthcare worker or social care worker is to self-assess as well.
Yeah,
Where are your limitations? Where are you less confident? When
continually
you have
CPD, continuing
your
professional development.
it's lifelong learning. So we are clear that responsibilities sit on both employers and employees regarding digital compliance. And you have talked about duty of care and the fact that it's not just about buying a system, but also training staff to use that system. But you're also saying that staff also, the onus is on them to learn how to use the systems that they're going to be using as part of their job, isn't it?
Yeah, definitely. They have to, they have to take responsibility for that. And like you say, even from the governance perspective, board members and owners, they need assurance that these systems are being used properly. Because ultimately, if systems aren't giving the output desired, they'll be taken away. They'll be removed off budgets because we know the margins in the sector and almost the ruthlessness, unfortunately, with the finances that, every penny sort of counts. Every penny counts. So just, this idea that, we'll just bring in this system, bring in that system, it's not quite as easy as that,
Yeah. So, okay, look, we are saying now, beyond the codes of conduct, professional conduct, beyond the basic duty of care requirements, digital compliance, actually, it's an effort that should come from everyone. Because, the evidence that you are uploading could be needed for a coroner's report. Or maybe somebody has raised a complaint. Or maybe somebody is being referred from a care home to a hospital. That information that you gave to the ambulance could make or break actually, whether that person is going to receive good care as they arrive at the hospital, or are they going to be on the phone now trying to call to find out what's going on with this person, what medication are they on. So I think sometimes people think, well, I'm just a carer, why does it matter? But actually, there's a huge responsibility on everyone there, isn't there?
Yeah, definitely. There's huge responsibility there. Like I say, these things are not really nice to have. So they're part of the world now. Technology is here to stay. There's a lot of proven cases where it's improved the way the way healthcare is done in this country, the way the efficiency side of things, but it needs to be adopted.
Yeah.
And obviously there's lots of arguments about people in the sector being underpaid, and I think that is also another cultural mindset problem that has to sort of be addressed in a way.
But no one goes to the care sector to get rich. You need to go somewhere else.
I agree with that sentiment as well. But I think when change happens fast, which is what technology can create, there's this expectation that other things should move as well,
makes sense.
Whether it's pay rates or whatever. And that's obviously a different discussion. But what I'm trying to say is I resonate with employers in a way because I can see where these resistances will come from and will continue to come from. But for me, it is a big part of governance. It is a big part because, like you say, there's risks if digital literacy is poor. We've talked about the risk with data, risk with compliance. But there's also the case of things not being done efficiently.
Yeah. So wasteful.
Yeah.
So look, policies and procedures on data security and responsible use of these systems, evidence logs, not just that the system exists, but actually it's embedded into practice.
Yeah.
So if we take it from there, actually, to say, look, what I'm hearing from you is that digital literacy is no longer a nice to have. It's actually something that needs to be part of the governance requirement. So from the the board level to senior management and floor managers on the front line, poor digital skills can put service users at risk. Business can become non-compliant straight away. They can lose a lot of money, and ultimately, actually, it's the service user that suffers. Is that a fair summarization?
I think that's I think that's a fair summary. And even like you say, putting policies in place for embedding and adoption of technology, I think those things have to be done. employees also need a fair crack at the whip, that that, you know, when they sign up to a job, for example, they know what they're signing up for, and they get the necessary support as well. And if I know the argument will always be about finding time, this, that, and the other, but I don't think it's like you say, it's not a choice really. These things have to improve. It's the way the world is going, and I don't see why, you know, the care sector should not have to go that way as well. I mean, anyone who walks into whether it's an office job, if you call it, or whether you're working in a supermarket, whether you're working in a restaurant or a pub, all these advancements are happening in those sectors as well. You know,
I mean, we self-checkout now.
yeah, we are the
Supermarkets.
cashier now, aren't we?
Yeah.
And you've got these smart shop apps you can go round, so you can compare pricing and. You know, like I say, even with say stock taking and inventory, I don't know that world that much, but from people that I do know in that world, all those systems
they're digitized.
have changed.
They're digitized, yeah. I mean, even I saw a documentary on the Amazon system. It's all these robots lifting things and putting them there and scanning.
Different world to even 10, 15 years ago,
Yesterday, actually, one of the professors at UCL, we were just having a discussion in between sessions, and she said, it's amazing, isn't it, that we get all this tech and we don't use it. For example, we all go into supermarkets with a calculator in our pockets, and no one uses that calculator, and many people get surprised when they see the bill at the till. That's sort of I'm one of them.
That's a very it's a very good scenario actually, and very relevant,
Yeah, you feel stupid, don't you?
Yeah. Oh, I didn't know that would be £80. Yeah, but if you'd gone and added everything up,
but also you can get these things that you scan as you go along.
Yeah, that's the smart shop
and you can
apps.
put things back.
Yeah.
But what I'm saying is, we constantly. Some people say, even to us, actually, companies like ours say, yeah, there are too many solutions looking for problems to solve. And I think, but some of the solutions are actually very useful.
Yeah.
Tech has been good to many sectors, including healthcare, including social care. And, you know, it's just how we adopt them. Why are we adopting them? What problems are we looking to solve? Are they a good fit? And how do we prepare to get them in? How do we train our staff? Are we ready to do that?
Exactly. Too many people think... Like, again, without referring to last week too much, too many people think by getting this in, it solves the problem.
Yeah.
X meets Y equals result.
Exactly.
It doesn't
Not quite
work like that.
Case.
Yeah. Unfortunately, some blood, sweat and tears have to go in with technology adoption. It all sounds a good idea, and it is if you follow a good process or a recommended process. It's not just going to come in, change your fortunes, improve staff morale, improve results, improve service user output or you know, performance in a way. So yeah, there's a lot of these considerations, but a lot of it does go down to digital literacy, I've noticed.
Yeah.
And digital literacy isn't just, by the way, end users.
Yeah.
It's even the people making the decisions about the procurement of the system. It's even the people managing the implementation. We've seen lots of examples where, whether it's a business owner or a CEO or you know, a HR manager or whatever with a fancy job title, there's issues there as well. So I don't want it to sound like we're battering the people at the bottom of the chain or on the front line.
But I mean, that's why we're talking about culture earlier, isn't it? To say I could be very digitally savvy in my own life, but when I come to work, I'm expecting you to show me how to do the job. And okay, if I'm supposed to have professional curiosity to perhaps suggest better ways as I go, or even question. But then sometimes people are constrained depending on the culture. Because if you come in and we say, this is how we want things done, it almost doesn't matter what you think.
Yeah.
It almost doesn't matter
This
what
is
your
what
prior
we're doing.
experience
Yeah.
is.
So
right?
tough.
Which takes us nicely to the next section that the team put together here. They wanted to hear some real world stories and costs of poor adoption. And I think perhaps you could think about maybe areas where things have not gone so well. I know you've given examples in the past, but again, if you're to balance it out to sort of say, why is it important for organizational readiness? Why is it important for management to make the right decision? And also, what are the responsibilities of the staff? So you can think of one or two examples where things didn't go quite as they should.
Yeah, I mean, when I was reviewing these questions, as I say yesterday, there were a couple of examples that sprung to mind. Like I said, we recently lost a client, a small care home group. Like I say, they purchased licenses for staff, but it was clear really from the outset, even when the team were preempting them to say, you know, are you ready for this onboarding? Who's going to be looking after this? They didn't assign anyone to manage this system or this implementation. They failed to attend some of the initial onboarding sessions, so we were rescheduling a lot of those. And then, as I say, because we like to keep in touch with a lot of, particularly our newer clients that are new to using the system, we want to make sure they're getting the most out of it. You know, the team would try the check-in calls, limited responses, whether it's email, whether it's leaving voicemails, whatever it may be. And then you look at the activity logs on the system to sort of see what are people doing. Is this system even being used? Is there a bit of a red flag here for us to, you know, really try and get in touch with these guys and see what they're doing with the system? And then, like I say, you notice not really much has happened. But then obviously when it comes to the next inspection or when the account is then due for renewal, that's when some problems arise and you start getting these questions from the client, and almost it feels like negative feedback in some ways, where they're trying to claim that the system hasn't done this and we haven't been able to do that and no one told us how to do this. So, and then obviously from a service provider perspective, you don't want to sort of start having an open debate about who's right and who's wrong. You're there to provide a solution. And that's the culture that we install in a lot of our staff working with clients, is like, even if the client is wrong or you feel the client is being unfair, the goal of us, or the you know, what we're employed to do is help these organizations regardless of the discussion. So that was one example. And then there's frustration at renewal where they think they've wasted money. They think that our service isn't what they expected, or it's not as good as they thought it would be. The relationship then inevitably breaks down. And, you know, even from our side, you try and do almost like a post-mortem in a way, or an audit of what happened with this account. You know, it's a customer that was with us for a couple of years, I think, overall. But yeah, there was limited use of the system. There was panic stations when it came to renewal on both occasions. And when you look at what that organisation actually got out of our system, it's very little. But then when you look at, like I say, the things that we tried to do to help them, I don't think there was much more in our power that we could realistically do.
Because, I mean, it's both ways, isn't it?
Yeah.
You're providing a service. You can give them demos, give them ongoing technical support depending on what package they're on. But the onus is on the provider to, like you said earlier, assign an owner from their side who really understands the system,
knows what it's
does
there
all
for.
the troubleshooting, and prepares their staff for adoption of the system. If it doesn't happen, there's only so much you can prompt people to do, because people are busy. You know, a lot of people in this sector are very busy. They haven't got time to do even some of the most basic things. Look, I completely get that. You've worked with also some organizations that were transitioning from paper records to digital. Maybe they have processes or procedures that they want to digitize, and they are looking to use our system, or they're already using on another system and we're looking to complement what's happening. What are your experiences with those? Have there been any bad experiences where you feel that things could have gone better?
Yeah, I mean, with this example, because of some of the extended compliance services we offer now, we are in that space of digitizing, you know, things that are going on, and even things like policies, procedures. So it isn't just, like you say, the e-learning and the training side now. Particularly recently, there's been an influx really in domiciliary care agencies coming to us to try and do this. So go from the sort of old-fashioned traditional methods of paper-based to digital tools. But because of issues with digital literacy, readiness, and just general not having really a plan of doing this transition, because like I say, it may sound easy. Oh, we'll stop using paper, we'll use a digital tool.
Without any roadmaps at all.
But with no roadmap or no plan, that's quite a shift in how your staff, for one, are doing things, but how your business is running. If your business has been relying on paper and it's then gone paperless, you know, I know a lot of companies have been doing this since the early 2000s with the going green and the idea of recycling more and so on as a society. But this is a big transition. So what we often see is that these people, there's a lot of resistance of change. They bring this system in, they try and do things digitally. They then maybe have fears of data being lost on the digital system, or people maybe uploading things wrong, that digital literacy issue again. So then they almost, some of them end up duplicating the work.
Yeah.
So they end up doing the paper-based and the digital.
So, yeah.
And then you've got duplicate of work. You've got more hours wasted from a workforce perspective, but you also increase the chance of errors. So if you have then two sets of data to look at,
which one is the
which
update
one is updated?
updated one?
We
Yeah.
talked about version control
Yeah.
earlier. And
Yeah.
if then you do have records that differ, say the digital one says this, the paper-based one says that, that could then cause a lot of complications, whether it be for a service user, a patient, or whatever the example is. So that's been my example. Again, sorry to pick on adult social care a little bit there, but the two examples I could think of for both scenarios, particularly for the dom care agencies, there seems to be a lot of people bouncing around different providers at the moment to find the right balance. But the key, like I say, I'm not saying all providers out there are great, and I'm not saying people aren't, you know, there might be cases of people being ripped off or not getting a fair service. But the readiness side and the digital literacy side is so important for those things, particularly those sort of transitions. Yeah.
Yeah. So just to summarize what you've said there, for our listeners out there, we're saying, look, you can avoid all these failings actually by just preparing better. Any organization, really, even for us, when we're changing some of the tech that we use, we're getting some new software developed. It takes a while. Actually, it takes a bit longer. Always takes a bit longer than you are budgeting for.
Yes.
So always make that allowance
Have
to
that
budget
buffer,
for a little
yeah.
bit more time. There's a fear of transitioning as well.
Definitely.
Now, because we're worried that if the system crashes, are we going to lose our data? I saw that when I worked in the NHS, we were worried about digitization. When we started doing clinical observations using this thing that keeps crashing, and then you don't trust the thing, then you go and put them in the patient notes. But then if the patient notes are not there for whatever reason, maybe you're seeing a patient in clinic, then you're missing a lot of the information that you need to make a decision. So ultimately, that can undermine care quality and safety of the patient or service user in a care setting. So unused licenses, duplicated work, failed inspections, it all adds up actually to a failing system if we're not careful. But it can be avoided. So obviously, we talked about a lot of the state of care, if I could call it that. We talked about a lot of the barriers. It would be nice to talk about some of the benefits. What can people do, and what are the takeaways? You know, so what are the solutions? How can health and social care leaders and managers overcome the digital skills literacy barrier? And also, what would be the benefits of them to do that for all stakeholders, including the service user?
Yeah. I think it's a nice way to sort of recap and end on more of a positive slant. So I think the first point is the recognizing digital literacy is a core skill.
Yeah.
It is important, and if you keep ignoring it, you're just kicking the can down the road. So the first point is accepting that, because I think without accepting that, you're going to constantly have problems. But I think if we break down the stakeholders, if we look at employers, build digital skills into induction and general CPD for staff. Make it part of the culture. Make it part of the process. Make it make it mandatory, Bring in digital skills, whether you have to get outside people in, whether there's internal programs you can deliver with senior members in the business, or maybe more people that are more, adept at digital literacy. Assign system owners and champions for these things. Don't just expect that, John or Karen over there, that they're good with tech, they'll take control of it. Have a clear plan on who's going to do what.
Make it their responsibility.
Make it their responsibility, yeah. Make it their responsibility. And, give them that authority. And I think try and protect time as much as you can for staff to learn and practice these things. I know that's a lot easier said than done, and people will probably think, well, it's easy for you to say sat there. You're not working in this care home, you're not working in this hospice or this hospital or whatever.
Yeah.
But finding time for these things is important, even if it's like lunch and learn style, part of team building, whatever strategies people are using in their business, try and adopt the digital literacy side as best you can. I think when we look at then employees, I think take responsibility for maintaining digital competence. Like you were saying earlier about people may separate their personal lives and their work lives and their social lives, for example. Take a bit more ownership and pride in that side of things, because technology is coming, it's coming fast, and whether we like it or not, is part of the job. And like you said, if you're not up for that job, if you don't want to sign that contract, then don't do the job. So I think it sounds a bit blunt, but we can't keep having this resistance, otherwise nothing's going to move on. I think asking for support, I know, like you said earlier, particularly if you're new to a company and people say, look, this is what we're using. People may feel a bit ambushed, they may feel a bit unprepared, particularly if the business hasn't given them the necessary onboarding or training to do it. But ask for support. And if support's not there, then obviously other things may need to be escalated to address that problem, and maybe business owners, etc., will then be aware of the problem, because sometimes business owners may be completely unaware that there is a digital literacy issue in the business, or a board member, for example, they might be completely out of touch.
It's a huge risk, though, isn't it? It should even be on the risk register, because
it should be a risk register item.
Because when you think about the potential harms that could happen, I mean, it's crucial for governance, isn't it? When you take it,
it's crucial. When you break it down to the level we have today, the more and more it just keeps bouncing back to governance. And I know we'll talk about governance as almost the last stakeholder in a way. But one more point on employees is digital tools, if we use them effectively, it is part of the safe modern practice in 2025, and it will continue to be, as we've said a few times. So resistance with technology, look, some tech that comes in isn't very good. Some tech available out there isn't very good. It could be a waste of money. It's not to say that all tech is great, but often digital tools are being put there to make people's lives easier, to make their jobs be easier to do, to get better results, and improve, ultimately, patient and service user outcomes. I think, like I said, when we go to the governance side, boards, like you say, must monitor adoption as part of compliance. They must be confident that there's a process there for these things. Like you say, they need to be in touch with this issue. And if they're not, then the people they're employing to run these services are not doing things, they're not doing them justice. And evidence systems should link digital literacy training to CQC frameworks as well.
Yeah.
That's really, really important.
Yeah. When you say about the boards looking at adoption, one of the things actually is, why are you adopting any innovation, whether it's a technology or whether it's a new way of working, is because you are not satisfied with the current state of things. Maybe they are wasteful processes, maybe they are procedures that are outdated, or whatever the problem is, or you just want to improve patient experience. So apart from compliance, even the return on investment is crucial, isn't it? If I'm a board member, I'm a director, or I'm a company owner in the healthcare sector or social care sector, I would like to see a return on that investment. So it still buffers me up to now. I know it's a fact that people pay for tech and don't use it. What are the benefits, actually, if people were to do this in the ways that you're suggesting? What would be the benefits if you were to give people a bit of takeaway from there?
Well, I'd say for providers, you'll get better value from systems. You'll get smoother inspections, stronger governance. I think they're the three sort of key takeaways or benefits that I'd put for that. From a staff side, you'll increase confidence, naturally. There should be less stress, because ideally the tech is there to aid these people and make their lives easier. There'll be transferable skills, for career development as well. So taking that, again, turning maybe a negative or turning that resistance into something positive for staff, I think that's important. And then from a service user perspective, that is often the person we don't think about in this scenario, is they'll get safer care, more responsive care. They'll have better communication with staff, with their families, whatever it may be. They'll have insurance that providers are using the most up-to-date and modern practices to look after them from a health perspective. and feel that their care is in safe hands.
Yeah. And people worry about tick boxes. It may actually get you a very good rating with CQC, maybe even outstanding. You know,
Yes.
your attitudes towards tech and your
Yeah.
culture around tech as
Yeah,
well.
you're
Isn't it?
being innovative. You're being visionary in a way. Inspectors, auditors are going to like all that. They don't want to see businesses, as much as traditional methods are tried and tested and work. I think there's definitely more kudos out there for the organisations that are looking to improve. They're constantly looking ahead, and we've talked about people who get excellent ratings with CQC or good ratings. The ones that stay excellent are the ones who are doing what we're saying. They're always thinking ahead, think of improvements, marginal gains,
Yeah,
and they take these sort of things seriously. Although like you say, you're not necessarily going to directly get any more points or any more money to say, oh, all of our staff have really good digital literacy skills. No, you're not. But when you break it all down, like
it
what we've done
filters to the
today,
quality of
it
care,
filters to
doesn't
the
it?
end result. Yeah.
To the end result. And look, that's such a powerful way to look at it. And I like to sort of summarize again before we get to the end. So you're still reminding us that digital literacy is not just clicking around the platform and looking at dashboards. You're saying that we need to build a culture where people are confident, they have the skills, and then they take responsibility, regardless of what their job role is. They know that they have a responsibility to understand the processes and also the digital tools and how they impact the work that they're doing. And it has to be in line with compliance and governance frameworks. So if we were to sum it up, to sort of say, look, we're summing up this area where we're talking about how we overcome the barriers, what are the 3 key takeaways that you could give to health and social care providers out there? You can address both staff and organizations, or you can just address decision makers.
Yeah, I think like you say, based on what we've touched on today, benefits, current issues, real world examples. I think the 3 key takeaways from this conversation are digital literacy is a hidden barrier.
Yeah.
It's such an important thing, and we're seeing more and more examples of it. And unfortunately, although the world is moving on, or whatever you want to say, technology advancements are improving, health and social care at times is still standing still a little bit. So digital literacy is it's a hidden barrier that needs to be broken down, and organisations need to take it seriously.
Yeah.
But also, employees have to take it seriously. So that takes me on to my second point nicely. Employees and employers have responsibilities in this area. Whether you want to call it equal measure or whether you think one is a little bit heavier than the other, but for me, they're both culpable. They both have responsibilities, and they both need to address this issue hand in hand. It obviously needs to be employer-led, but employees, as you rightly said, have a duty of care in that respect. When they sign that contract or they go into that workplace, they're doing a job, and this is now part of the job. And I think the other one is don't look at this as a drain or a burden or something negative. The payoff and the benefits are huge. If you can implement within your workplace as part of your ongoing processes, culture, as part of your governance framework in a way, if you can improve digital literacy in the business and across your workforce, the payoff is huge. The benefits are huge. Like I said, there's better results as we've just gone through for employers, employees, board members, key stakeholders, and most importantly, service users and patients as well. There's lots and lots of benefits, and even like you say, even from the other stakeholder perspective of auditors, people regulating your service, commissioners, even they are all going to look on these things, I think, more fondly than a business that is struggling to adopt tech, is using outdated systems, and are not moving with the times.
Look, there's nothing that I would change there. I remember there was one website when we were doing some competitor analysis many years ago. The big words: "Do you want to save money? If yes, click here.
Yeah.
Do you not want to save money?
Yeah.
Click here. So
Click
it's almost
here,
like
yeah.
it's written on the wall. It's so
Yeah.
clear.
It's so blatant, but some people don't pinpoint that as the problem. I think that's why it's that hidden barrier.
Yeah.
When we're sat here speaking, and because we work in this area, we speak to these people for a living, basically. It may be more apparent to us, but I think there'll be some people listening that are going,
I need to go and check something right now.
this could be interesting what these guys have discussed today. Maybe I'm missing something when I'm doing my checks, my audits, or where I'm trying to solve a problem. I'm trying to investigate why we're not doing so well here, or why we can't adopt this.
Or why are we wasting so much money on
Or why are
tech
we
that
also
is not
wasting
changing
money?
anything? Isn't
Yeah.
it? But again, we specialize in looking at blind spots. And I don't think we realized it at first to say the way we're looking at things is quite different. We're always trying to figure out better solutions. And I guess part of it is because we worked in the healthcare sector, we worked in the social care sector, and we worked under certain constraints sometimes where we just felt things could be done better.
Things could be done.
And I think we've brought that here as well. We may not, there are companies that have maybe better tech than by far.
Yes.
But actually, also, what sort of support do you give to people that are using your platforms?
Yes.
And for me, that's the biggest thing. That's why I always push the teams to say, look, make time for demos. If somebody has a problem, be responsive, because that problem actually could cost them a contract.
Yeah,
That problem could potentially
the knock-on effect, the domino effect,
cost lives. So for me, actually, it's a continuation of our discussion around the quality of health and social care service. Safety of service users. We know if you go to those domains, CQC domains, safe, safety, responsiveness, caring, well-led, all those things matter. And actually, when you take a topic like this that looks quite boring and dull, say what is it about digital literacy that you could tell me? I think we've proved that actually we could spend a whole day talking about digital literacy in the health and social care sector. And I'm grateful, obviously, for Lewis bringing these insights. Lewis works with a wonderful team of people that are in technical support. He works with our IT development teams, our project managers, and our you need guinea pigs, isn't it? We have care providers who allow us to come and work with them so that we can learn some of the challenges that they're facing and build some tech which they can then test and then give us feedback before we deploy it to the wider care sector.
Yeah.
So I appreciate that. And next time, we're going to be exploring another critical issue, which is the intersection of governance, compliance, and workforce development from a digital perspective. These are big words in a way that are very relevant to what we're doing in the sector. But we have to, whenever we come out here, we try to unpick these things, try to simplify them, put them in day-to-day language that people will be able to identify with their own organizations. So I'm looking forward to next week. Thank you very much, Lewis, for joining us this week.
Yeah, thanks a lot, guys. And like I say, we've got a bit more to come in this area. The next few episodes are going to focus on some of these issues with systems, but each week we'll choose a different theme. Yeah, so looking forward to next week's episode.
Yeah, in the meantime, you're following us on Facebook, on X, and LinkedIn. We're going to be sharing some tools that you can download so that you can do your own self-assessment on digital skills for decision makers as well as staff members.
Yes.
So that you can start to implement some of the suggestions that Lewis was giving. Thank you very much for joining us. See you next week.
Thanks, guys.
Okay.